finish alcohol and drug abuse as far as possible. Remaining Eura class by so. So tomorrow we would not be having any class because there's BDS pre-board exam, Viva exam tomorrow and day after tomorrow. If I am able to manage the timing for the Viva as well as class, then we'll be having class day after tomorrow. Otherwise, we'll have the remaining one class on next week. All right. I hope everyone got that message. Next week, Monday, Tira, maybe at 9:30, I'll be taking your classes. All right. So let's begin with our today's topic. Today we'll be reading about drug abuse and dependence and addiction. We'll be reading about the types of drugs that are being abused. Okay, and there are few terms in this chapter like addiction one IQ, habituation IQ, tolerance one IQ, psychological dependence, costo unsa, physical dependence, costo unsa, and there are classification of drugs. This drug abuse classification of drugs are there. Two types of classification. We will be reading about that as well. We will be reading about the difference between addiction and habituation and overall drugs, ma'am. Now, what are the findings, post-mortem findings in the case of drug abuse? Okay, that we will be studying in this chapter. Now, before that, what do you mean by drug one, Ekio? What is drug one, Ekio? पहिला सुरु मलाई कसैले answer त्यो. What is drug? Please participate. Are you there in the class or not?
Drug is any substance which we use to treat disease.
Okay, drugs. A drug is any substance which is used for some kind of treatment. Treatment, if some abnormalities are there in the normal 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 bodyमा हुनुपर्ने सिस्टम बाहेक कुनै abnormality छ भने हैन त्यसलाई मेन्टेन गर्नलाई त्यो or maintain any of the function, then we give substance which is used as a treatment is drug. And what do you mean by abuse? Drug abuse भनेको
More use than recommended.
हजुर
Recommended doses भन्दा बढी.
ओके नर्मल डोज जुन अब ट्रिटमेन्टको लागि युज गरिन्छ त्योभन्दा बढी युज गर्यो भने हो.
म्याम जेको लागि युज गर्नुपर्ने त्यो बाहेक अरू कुनै उसको लागि युज गर्ने.
ओके हैन चाहिने भन्दा बढी प्याटर्न चाहिने भन्दा बढी डोसेजमा लियो अथवा पर्पस जेको लागि युज गर्नुपर्ने त्यो बाहेक अरू कुनै पर्पसको लागि युज गर्यो भने द्याट इज known as drug abuse. Now, WHO ले कसरी define गरेको छ? Let's find out. Okay, drug is any substance other than those required for the maintenance of normal health that, when taken into living organism, may modify one or more of its function is known as drug. Now, abuse मा चाहिँ substance abuse or drug abuse को एउटै definition हो. That is maladaptive pattern of drug use manifested by recurrent and significant adverse consequences related to the repeated intake. So repeated intake ले गर्दाखेरि चाहिँ if there is any kind of adverse effect which is significant enough, then that is known as drug abuse. All right. अब अरू डेफिनेसन्सहरू छ जस्तै substance intoxication भनेको unwanted psychological or physiological effect that causes maladaptive behavior is known as substance abuse. अब आउँछ physiological or physical dependence. यसमा चाहिँ there is alteration in the neural system, which is manifested by tolerance and appearance of withdrawal symptoms. Now, कसरी थाहा पाउने neural system may changes has occurred or alteration has occurred भन्दाखेरि if there is any tolerance, development of tolerance, or if certain drugs are stopped and that patient shows withdrawal symptoms, then you know that there is physiological or physical dependence. अब आयो definition of addiction. Addiction भनेको chronic relapsing disorder characterized by compulsion to take a drug, resulting in physical or psychological social harm and continued use despite evidence of that harm. Okay, so there is compulsion to take the drug, which is craving, and कसरी थाहा पाउने there is compulsion भन्दाखेरि because there is a physical, psychological, and dependence and social harm. Okay, and even after knowing that there is harm are being there to that patient itself as well as family, socially पनि भनेर थाहा हुँदा हुँदै पनि he cannot resist and continue taking the drug is known as drug addiction. What do you mean by habituation? Is a resulting from the repeated consumption of drug in which there is psychological or emotional dependence on the drug. So what is the difference between addiction and habituation? Can anyone answer?
Ma'am, in doses, drug addiction tendency to increase, but in habituation, there is no tendency to increase.
Okay, addiction must say tendency to increase is there, but whereas in habituation there is no tendency. What else? Or okay, difference?
Addictionमा चाहिँ both individual and society-लाई harm गर्छ अनि but in habituation individual-लाई मात्रै harm गर्छ.
That's good. So harming to an individual is there in habituation, whereas it's harming to the not just to individual but to the society is there in addiction. Aru? Anything else?
Ma'am, habituation is psychological र emotional dependency मात्रै हुन्छ तर एडिक्सनमा चाहिँ withdrawal symptomsहरू पनि देखिन्छ.
Okay, that's good. So that's what I wanted to hear because it's written out there in the slide itself. In addiction, there is physical or physiological dependence पनि हुन्छ, whereas in habituation there's only psychological र emotional हुन्छ. यसमा addiction मा तीनटै हुन्छ भने habituation मा habituation मा psychological, emotional र emotional dependence हुन्छ भने चाहिँ यसमा हाम्रो addiction मा one more dependence is there, that is physical dependence as well. अनि drug dependence भनेको चाहिँ combination of both habituation and addiction is drug dependence. Now next is the slide of the difference between the two. Most of you have answered all that compulsion हुन्छ एउटामा addiction मा yes, habituation मा desire मात्र हुन्छ. Dose tendency to increase is there in addiction, it's not so in habituation. Dependence on psychological र psychological or physical हुन्छ, यसमा only psychological. Withdrawal symptoms, obviously if there is physical dependence then it's characteristic, Here it is mild or none harm to the individual and society, whereas it's harm to the individual only. Now, pattern of drug abuse. So there are certain pattern of drug abuse which may overlap with each other. Importantly, there are four patterns. के हुन्छ भन्दाखेरि initially it starts with acute intoxication. How do you know acute intoxication has occurred? There is a transient condition resulting in disturbance of level of consciousness, cognition, perception, affect, or behavior, or psychophysiological function and responses. Okay, so first, after intake of drug, there is acute intoxication, and if the drugs are being taken persistently, then the person develops withdrawal state or withdrawal symptom, which can be partial or total. It's usually after repeated intake of high dose of drugs. Now, it starts from 6 hours to 8 hours or from 24 to 36 hours is the second stage. And the third stage is physical dependence. Now, there is physiological requirement of drug. Okay, so there is behavioral and cognitive phenomena in which use of substance taken on is much higher priority for an individual than other behavior that once had a greater value, होइन? So अरू केही काम गर्नुभन्दा इम्पोर्टेन्ट अब नर्मली कलेज जानुभन्दा अथवा नर्मली वर्कमा जानुभन्दा इम्पोर्टेन्ट वाट के हुन्छ भन्दाखेरि this intake of drug is more important than other issues. Now, psychological dependence, the mind needs to continue taking the drugs. Physical matra, mind ma pani there is need to continue the intake of drugs. Now, what are the symptoms of drug dependence, or what are the harmful effects after if there is any kind of drug addiction or the habituation भन्दा नि एडिक्सनमा के हुन्छ भन्दा loss of appetite and weight, clumsy movement, unsteady gait, tremors, reddening and puffiness of eyes, unclear vision, slurring of speech, loss of interest, sleeplessness, lethargy, passivity, acute anxiety, depression, profuse sweating, depersonalization, emotional detachment, impaired memory and concentration, preference of solitude. Okay, so patients tend to stay in solitude because they have lost interest and there is sleeplessness, lethargy, passivity, and combined with anxiety, depression, and personal depersonalization, emotional detachment. Now, talking about the classification, we are classified into psychoactive drug classification. Usma ready muscle. So just go through it. Sedative, stimulant, opiates, hallucinogens, major tranquilizer, antidepressant, anti-mania drug. So, our sedative we have barbiturate, minor tranquilizer, alcohol, stimulant, amphetamine, methylphenidate, cocaine, opiates, heroin, methadone, morphine, hallucinogens, major tranquilizer, chlorpromazine, antidepressant, tricyclic, monoamino oxidase, anti-mania drugs. Next is WHO classification of dependency. You say only psychoactive drug classification this depends upon the dependency. अब कस्तो किसिमको dependence, physiological हो कि psychological हो कि कुन किसिमको dependence, tolerance हुन्छ कि हुँदैन, त्यो accordingly it has been classified into 5 types. Okay, first one is morphine type. Of कतिवटा we have already studied, we don't have to go into detail because about cannabis type we have talked about cannabis. So morphine type morphine, heroin, opium, methadone. High degree of tolerance and physical dependence takes place. Barbiturate type secobarbital, pentobarbital, amobarbital. Strong desire to take drugs, tolerance from both cross tolerance takes place. Lethal if barbiturate is combined with alcohol, then it becomes very lethal. So this is the with the intake of barbiturate plus alcohol may cause death. Both physical and psychological dependence takes place. Next is cocaine type. Cocaine type मा चाहिँ alkaloid from erythroxylum coca-बाट निस्किने हो cocaine. Okay, so can be taken by oral, intranasal, smoke, or intravenously. And central stimulant inhibits reuptake dopamine along with non-epinephrine and serotonin. We have talked about this, I know cocaine detail so we don't need to go into detail. Cannabis derived from hemp plant inhibits adenine cyclase activity, no tolerance, absentee syndrome takes place, and psychological dependence ranges from mild occasional trip to marked compulsive. So this is more habituation than addiction. Okay, cocaine is addiction. Next is powerful stimulant, that is amphetamine type with peripheral sympathomimetic effects takes place. Need or desire is present. Tolerance, tendency to increase the dose. Dependence is psychic, and low acidity syndrome is there. So these are 5 types of drug type which WHO has classified according to the addiction. There are certain terms that you should be familiar with. I think I've mentioned this earlier, but I'm not sure. BDS like cotton fever where drug is supplied in cotton bags. This water extract of that cotton bags is mixed with the drug, and if that drug is injected in a person, then that causes fever, high grade fever, that is known as cotton fever. अर्को आउँछ हाम्रो एउटा term that is known as drug abuser's elbow, where there is myositis ossificans, repeated needle puncture le गर्दाखेरि there is myositis ossificans in drug abuser's elbow. And another term, a very important term is there, the short notes मा चाहिँ सोध्न सक्छ, body packer र body stuffer भन्छ. Now just try to understand that these are the people who try to transport drug from illegally transport drug from one place to another. How do they transport one? Actually, there are 2 methods how they transport. Both are basic, same, concept is same, where drug is packed in cylinders, which is again wrapped with plastic wraps, and multiple layers of latex is there. अनि अब प्याकरहरूले चाहिँ इनिशियली पहिल्यै सुरुमै खाएर गएको हुन्छ ड्रग्स. Okay, and how do they transport भन्दाखेरि they swallow the drug with drug loperamide to reduce gut motility, and as soon as they reach to the desired destination, they take it out by using laxatives. Okay, that is body packing. Stuffer they take the drug along with them. Okay, but once they feel that they are being caught, then to conceal the evidence, they swallow the illegal drugs. Now, why do we need to know about this one? Like it's एउटा त immediate intoxication हुन सक्छ due to leakage of the drug. Okay, so body packers or body stuffer syndrome of illegal drugs are compressed into cylinders about 25 to 12 millimeter size, and heat sealed plastic films are wrapped with multiple layer of latex. I'll be showing you a few pictures on this packers or stuffer. How do they pack one? I'll show you the pictures. All types of drug abuse, volatile substance abuse is there, where there is substance abuse by toluene, gasoline, xylene, benzene, methylene, butane, propane, kerosene, amyl nitrate, butyl nitrate, etc. If you inhale the vapor from the cloth saturated with the volatile substance, that is known as huffing. अरू के मेथड हुन्छ भन्दा हफिङ, अर्को चाहिँ प्लास्टिक bagging हुन्छ. Plastic bag inhalation is bagging, and sniffing directly from the neck of the container use गर्यो भने चाहिँ bagging हुन्छ. Let's see some pictures on these body packages stuffers. This is after the dissection of stomach. You can see some a little bit different than the normal finding. So when you dissect the stomach, you can see this presence of drugs wrapped in plastic latex. So these were taken out from the body. It was then washed, and this is how it appears. When you measure it, यदि हुन्छ dimension यिनीहरूको झन्डै 1 centimeter. Okay, so multiple layer of plastics are there. Okay, whoever is on unmute, you can mute yourself. If you have any problem, you can share. Mahesh? Mahesh, के भयो problem? के सोध्नु छ? Okay, let's wait. Mahesh? All right, let him be in unmute. Okay, cause of death is sudden cardiac arrest, hypoxia, plastic bag asphyxia, aspiration of vomit, reflex cardiac arrest, and accidents are the causes of death. Now, how do you investigate the drug abuser's death? It's always better to investigate the crime scene. Okay, you can find accessories. Drugs may be hidden. Natural orifices or it can be hidden. Needle, syringe, or tourniquet may be found. Clothing, you can look for the drugs in the clothing. Psychedelic posters or देखिन्छ. While doing autopsy, you can see externally, you can see wasting signs and signs of self-neglect. But tattoos may be present. Why do you think tattoos are present in drug abusers? Anyone can answer?
To hide the marks of injection sites, scars.
Yes, very good, Sukriti. That is to hide the injection marks. Tattoos are done, okay, and tattoo by pani, they try to hide the marks by rubbing it with rough surfaces, few stone or living rub golden, also more scar may be present or tattoos may be present, all right. And when you examine externally, the needle track line may be seen, linear needle track scars may be seen. Why this is produced? Because fibrous vein of antecubital fossa, forearm dorsa of hands, scalp, neck, inguinal areas, shoulders, inguinal region, genital area, popliteal area, ankle and foot. These areas, you fibrosed vein, that is known as linear needle track scar. Now the finding is there, that is turkey skin, where this is due to the deposition of carbonaceous material, black discoloration. This is if the drug is adulterated or mixed with other substances, then this turkey skin can also be seen. Another finding is chronic edema of hands secondary to thrombophlebitis. So fresh from punctures urban देखिन्छ, which is again if you examine the track of the vein, you can see perivenous hemorrhagic tract, hyperpigmented macule. They can be seen. Additional damage due to attempt to remove. Multiple circular atrophic scar may be seen. Skin popping ले गर्दा. Skin popping भने के हो? What is skin popping? कोही आन्सर नदिने स्किन पपिङ भने के हो?
म्याम त्यो स्किनमा ड्रग हाल्ने
के हाल्ने?
स्लो अब्जर्प्सन हुन्छ म्याम, त्यो लङ लास्टिङ हुन्छ।
Skin popping भनेको how the drug is taken.
Skin को तल डिपोजिट गरिदिन्छ।
Skin को तल भन्दा पनि subcutaneous tissue हैन? Route of intake चाहिँ it's via subcutaneous tissue. Skin popping. त्यसमा चाहिँ multiple circular atrophic scar is seen. Alright, and perforation of nasal septum, if there is sniffing and snorting is done, froth at the mouth and nose is seen. Internally, when you examine the GI tract, you might see the pins or capsules. Perivenous fibrosis is seen when the hemorrhagic tract or the fibrous vein is dissected. Then you can see perivenous fibrosis. Histologically affected areas shows fibrous necrosis, replacement fibrosis. I know if you examine that area, the vein area you can see fibrous necrosis or replacement fibrosis may be seen. Hepatic lymphadenopathy, hepatic portal triaditis, enlarged lymph nodes, pulmonary edema, bronchopneumonia or aspiration of gastric content are the other findings. Froth in the upper respiratory tract is also the finding. Pericardial, pleural and peritoneal effusion may be seen. Splenomegaly is very much common. Our cause of death due to overdosage and hypersensitivity is very, very common. Especially heroin hypersensitivity is very common. And death appears due to acute left ventricular failure, gross pulmonary edema, and froth is seen at mouth and nose. So let's see a few pictures on drug abuse and addiction. This is presence of froth in the mouth. Okay, you can see fibrous veins, perivenous fibrosis. Again, same, you can see the multiple puncture marks out here. Perivenous fibrosis. So you can see hemorrhagic tract out here. So additional removal of the scars, you can see the scars here. You can see the macule present out here, atrophic scars. So this is it about the drug abuse. Okay, so केही छ भने सोधो नभए चाहिँ let's sign in back after 5 minutes.